So my name is Marianne Brodmann. I'm here working at the Medical University of Graz, Austria. I'm the head of the Vascular Medicine Department, the Department of Angiology, and I focus with regard to my research in endovascular therapy in patients with PAT. So the topic of the talk today is the RANGER II SFA trial, the randomized controlled study and the results in women patients with occlusions and severe calcifications. The RANGER TCP is a low-dose paclitaxel-coated TCP with only 2 micrograms per square millimeter paclitaxel on the surface of the balloon. So it's a low-dose paclitaxel-coated balloon, and therefore it's very necessary to show the efficacy data of a low-dose TCP in comparison to other competitors which are on the market, which are usually high-dose paclitaxel-coated balloons. So if such a TCP is showing efficacy also in the long term, this is very important for us, as we do not need, as endovascular physicians, as we do not need that much paclitaxel per patient. The study design is a randomized controlled study. It's meaning that we compared the RANGER TCP to an uncoated balloon, and it was a purely cohort with purely claudicants above the knee disease, and we have now also subgroup analysis for different subgroups, and as already mentioned, for women, for CTOs and severely calcified lesions, which is the issue of this talk, that also in this subgroup we evaluated a low-dose paclitaxel-coated TCP for efficacy and safety. The key findings is that also in a really complex patient cohort, meaning women, because they have usually smaller vessels, CTOs, which is usually difficult to treat, and severely calcified lesions, which is also a treating challenge. The low-dose paclitaxel-coated RANGER TCP showed really great data and can be compared to others in the market, meaning high-dose TCPs, really showing good efficacy and safety for the long term. I would suggest the use of the RANGER TCP in all kinds of patients, also in complex patients, as this subgroup analysis are showing, because it's not only safe due to the low dose, but it's also very efficient for the longer term follow-up. And I think this is really very helpful for us. So you can use this kind of TCP, the RANGER TCP, as a regular TCP for every patient you want to treat. So the take-home message for would be, from my point of view, that also low-dose paclitaxel-coated balloon can produce really efficient long-term outcome data, and there's also a very favorable safety profile which can be achieved with a low-dose paclitaxel-coated balloon in the long term.